Hello, I'm going to discuss Streptococcus pneumoniae and dealing with it, especially the containment, elimination, and prevention of this pathogen. So once again, who is impacted? And we're just going to discuss this infographic. People with weakened immune systems, and you are more likely to get an infection regarding to this pathogen or relating to this pathogen if you have a weakened immune system. Adults usually only make up about 5.14 to 6.14 cases out of 100,000. Those over 65 make up 36.4 cases out of 100,000, and those under 1 are making up about 34.2 cases out of 100,000. Certain symptoms you should be looking out for are fever, chill, shortness of breath, sleeplessness, hearing loss, altered levels of consciousness, joint pains, and increased sensitivity to light. These are all symptoms from diseases such as septicemia, meningitis, and pneumonia, and strep pneumo causes these three diseases mainly, and so those are things that you should be looking out for. And if you feel any of these symptoms, you should seek health professionals for their advice, and you may need to be hospitalized this is all to help first prevent the spread, and secondly for your treatment. And so you may be quarantined in a hospital, and all of these things might happen. You will be tested, of course, if you have any of these symptoms, and they could do blood tests or cerebrospinal fluid tests where this bacteria may be hanging out and see if you have this pathogen. The further containment of this pathogen is going to be done to stop it from entering. So it is an opportunistic pathogen, and it spreads directly from person to person, indirectly from surfaces, and spread by droplets. And so it is hard to stop it, but there are a few things that we can do. First thing is wearing masks and other respirators around people that have it, or these people themselves wearing it to stop the droplets from being into the air. And proper hand washing. Proper hand washing is a technique that we should always be observing, but especially in this case, hand washing is incredibly important for eliminating this bad pathogen and getting it out from our contact so we can stop that direct contact. Covering coughs and sneezes, of course, helps it stop from for going into the air and spreading that way, so that's also incredibly important. And sanitizing and disinfecting surfaces. This is important for doing it by surfaces that people may have touched with strep pneumo, and it's also just an important practice. And I think that even now, most of these containment and ways of containing this bacteria are due to or precautions that we're taking now in the COVID-19 pandemic. And containment of these really is done in a clinical setting and a quarantine setting, and is just making sure that you are not coming into contact with other people and that you are limiting your contact with others. And that is incredibly important for any sickness, and especially strep pneumo, and especially those that have weakened immune systems. Elimination and prevention is rather simple. Eliminating this pathogen is done by antibiotics, which are broad spectrum antibiotics, and other supportive care given in the hospital and clinical settings, such as fluids, and making sure that you are getting proper nutrition and your body is able to deal with this. Preventing this is at a public health spot, is ensuring people are vaccinated through the pneumococcal conjugate vaccine, and it should be administered to people under the age of 2, but above the age of 65 is what is recommended. For more information, you can go to the CDC website, and thank you so much for your attention.